Hey friends, it's Amber, and this is Against All Odds, where we talk about rising, rebuilding, and thriving. Today, I'm joined by Leah Hughes, ACNP-BC nurse practitioner, an acute care nurse practitioner, and founder of Mountain Roots Holistic Healthcare. After 20 plus years in medicine, she blends clinical training with functional and integrative approaches to help people find the root causes behind stubborn symptoms. Leah is also a breast cancer survivor who has navigated significant mold exposure on top of all of that. She experiences that the experiences that she's had has shaped how she cares for others. This one is compassionate, practical, and hopeful. You'll enjoy her story. Leah, welcome. You are a nurse practitioner. You are someone that owns their own business and has been through some hardships of your own. I would love to know, in your own words, what is Mountain Roots and who do you serve?
Well, Mountain Roots Holistic Healthcare is my business. It is, I say, a functional, integrative, holistic kind of almost boutique medical service for individuals who are looking for something beyond conventional medicine, is what I would say. It is kind of hard to explain what I do sometimes, but as my name says, Mountain Roots, our goal is typically to help people get to the root cause of why they feel the way they feel, or why their family had certain medical problems that they're trying to avoid, or just if you just want to feel better, and you just want to invest in your health so that you're not paying for it later. That's where we come on board for patients. So we do anything from working with people who have severe chronic illnesses, to people just looking for longevity and wellness. Common things I hear from patients are, why didn't my doctor ask me that? I know something's wrong. I've been to a bunch of doctors and they keep telling me there's nothing wrong. I know something's wrong. Those kind of things are the things that we hear from people. And so we're here to serve anybody and anybody looking. We do serve adults. I will kind of go down to age 16, but primarily adults. And we're here to really serve people and listen to their story and listen to them so that we can help them achieve the goals that they want to achieve, and help them feel better and have happy lives that aren't full of fatigue and emotional and physical distress.
I love that. And so often, folks who have been through chronic illness and going from doctor to doctor to doctor, and everyone says, I can't figure this out. I don't know what this is. Or they tell you it's depression. Or they tell you that it's something that is in your control, when most likely it's probably not. It's probably a hormone imbalance, or it's something I mean, you're going to talk about all of this. I'm not the expert here, but I really feel
No, you're so
passionately
true.
about that.
And what we do is wellness beyond symptoms. We want to really dig down and not only find why and the reasons. And I will say that things usually don't work in isolation, unfortunately. I wish it did. There's usually never just like one reason or one magic bullet. It's usually a multitude of things. Um, but we want to get you that, help the patient figure that out in a way that works for them to achieve the goals that they're looking for, and for that to be um, a solution, not just a band-aid, if that makes sense. I don't want people, I mean, I'm a business owner, so of course I
Of
want my
course.
business to keep going, but my goal honestly is not to have people be my client forever.
Sure.
We do a lot of education, and I want to set people up to learn and understand what's going on so that eventually they can leave the nest or leave my practice and they just need to come back when they need a little tune up or something different is going on, so that they have those tools that they've learned about how their body works, how other things work in conjunction to affect their body, so that
Mm-hmm.
they can do things for themselves and not have to depend on people like me all the time.
Yeah, no, absolutely. I can really appreciate that your goal is to keep people out of your office essentially. You want to heal that root cause. Um, you talk a lot about wellness and I'm sure a lot of that comes into self-care practices and making sure our nervous systems are regulated and all of the things. So, can you share one daily ritual that makes you feel super grounded right now?
What I'm doing right now actually is sauna. I
Ooh.
have a really cheap sauna that you can get on Amazon. Like, you don't have to spend a lot of money to get a sauna. And I try to spend at least 10 to 15 minutes, if not 30 minutes in there, because it helps. It's a quiet time, helps you ground your mind, and you're sweating out toxins through your skin, which puts less pressure on your liver and your kidneys. And unfortunately, it does not matter how healthy you are. You could feel 110% right now, but the world, we are just inundated with toxins just from the minute you wake up to the minute you go to bed at night. That no matter how careful you are, you cannot afford. And our bodies have not evolved to be able to detox the amount of toxins that we are currently exposed to in modern living. So, having any kind of detox ritual will help anyone feel great. And there's lots of really good research out there about, I just read 56 minutes of sauna a week decreases your overall mortality by 40%.
Oh, interesting. Okay. Okay. So really sweating those toxins out. Can you give us an example of a couple of toxins that we experience daily and are acquiring into our body daily that maybe we don't know about?
I'd probably say the biggest one are the BPA's, which most
Yeah.
people should be aware of in
Hmm.
plastics.
Yes.
Um, and we are drinking out of plastic water bottles. We are storing our food in plastics.
Yeah.
We're heating them up in plastics. I would say the toxin chemicals in plastics are probably one of the biggest one. And then, um, you know, you are exposed to chemicals when you fill up your gas tank from the
Hmm.
gasoline, and um, chemicals from clothing. Have you ever
Yeah.
gotten something brand new in your clothing and it kind of has a chemical smell to it? And
Yeah.
that's part of the chemical process in the manufacturing of the fabrics. Those are toxic to you as well. So it's just those are chemicals that we are exposed to every day. And then a lot of us get exposed to things like mold, mycotoxins.
Hmm.
Heavy metals are another big one. We can get exposed to heavy metals through our water, through things we eat and drink.
Yeah.
Also, mercury fillings in our teeth is another
Hmm.
heavy metal that a lot of us have and sometimes don't even realize.
Yeah. Yeah. So true. The BPA one is really interesting, like just leaving your water bottle, your plastic water bottle in the car and it heats up and it melts in there and then you're drinking it and you don't even know. So that's yeah. Yeah, that's a really great point to bring awareness to that. Your background, you've worked across the healthcare system for more than 2 decades, a really long time. And I'm curious to know, what did those years in the healthcare system teach you about why some symptoms linger?
What did it teach me about why things linger? Well, I mean, like I said, the biggest thing that I've learned is that there is no magic bullet. Um,
Yeah.
and unfortunately, I think that advertising, is not great, and we kind of, in general, as Americans, have this perception that we can take a pill and it's going to fix everything.
Right.
And really, anybody who has been around the block a little bit in life, right? We all kind of know usually the easy way out doesn't usually work,
So
unfortunately.
true. So true.
And I mean, that's the same in medicine that, we are in medicine and in research and literature, we are trying to find shortcuts and
Yeah.
the easy way out. But unfortunately, 9 times out of 10, it doesn't work that way. And that
Yeah.
what I've really learned also too is there's a lot that we can do for ourselves that's way beyond having to see a doctor or needing medical knowledge.
Mm-hmm.
And that by focusing on little things that you as a person can do, you can really make a big dent and improve your health.
Yeah. Yeah, sure. Absolutely. It's so true. And just like being an advocate, for yourself throughout the whole system, which we'll get into a little bit. Um, Something also interesting in your bio is that you worked early on with people living with serious mental illness. How did that shape your empathy and your approach to a whole person care in your practice?
I have like a sweet spot for mental health. I started mental health. I was a case manager for the chronic mentally ill. I have a bachelor's from Purdue in psychology. Um, I work with schizophrenics, bipolars, people with severe mental illness, and they have a lot of challenges just functioning in everyday life.
Yeah.
And when I came to Colorado, right before I opened my own practice, the reason I came here was I was offered a job working in an integrative psychiatry practice. And for
Ah.
the first time, and I think most people can relate to this, like as you age from college, you kind of take a lot of different jobs that do
Mm-hmm.
different
Mm-hmm.
things. And for the first time, I was like, oh my God, this is a job that's going to combine all the things that I've learned
Yeah.
into one place and I'm going to get to use it. And that was exciting.
Yeah.
Um, and that's what I like. And what I've learned is that mental health is not just you were bullied in third grade or you have trauma with a capital T, that
Mm-hmm.
there is a lot of physical, medical reasons that people have mental health symptoms that I think often don't always get investigated and get dismissed. And that is what my education and training I've come to learn. For instance, exposure to mold and mycotoxins cause and Lyme disease is another one, and post
Yeah.
COVID actually affect the blood brain barrier, so it
Yeah.
allows chemicals and toxins to get into the brain, and it actually causes atrophy or shrinking of certain regions of the brain.
Mm-hmm.
So those people will have depression, mental illness type symptoms, but
Yeah.
they're not anything related to, out exterior trauma or
Right.
mental
Right.
symptoms. And
Mm-hmm.
often they will get labeled, and they will
Yeah.
also get band-aided with medications. And most psychiatric medications, unfortunately, are there to treat the symptoms. They
Mm-hmm.
don't do anything about what the true cause is.
Yeah.
Even Epstein-Barr virus, if you're
Ah.
familiar with
I
that,
am.
that
Mm-hmm.
has been linked to a number of schizophrenia. It's been linked to schizophrenia
Mm.
and bipolar,
Interesting.
also to multiple cancers. So there's lots of
Yeah.
viruses as well.
Mm-hmm. Yeah.
Um, even something I think you mentioned earlier, hormones,
Yeah.
even something as simple as low testosterone. Low
Yep.
testosterone in men and women
Mm-hmm.
causes depression, and
Yeah.
it's that kind of it's not usually the suicidal type depression, but it's the low motivation, I can't get off my couch kind of depression. What's wrong
For
with me?
sure. Yeah.
And that they don't need uh, Prozac or
Right.
antidepressant. We just need to give them testosterone back to a normal
Yeah.
level, and
Yeah.
it will it literally sometimes changes their lives,
Mhm.
and how
Mhm.
much better they feel. So
Yeah. Yeah.
and I'm a strong advocate of that, that if you are having mental health symptoms, a
Mhm.
lot of times conventional medicine, unfortunately, the first thing they're going to do is they might run some basic labs like a
Yeah.
CMP, CBC. Those usually don't show these type of things. Those usually
Sure.
show normal.
Right.
And then either your primary care, or they're either putting you on some kind of antidepressant or psychiatric
Yeah.
med and sending you to a therapist.
Mhm.
So I strongly encourage people to, advocate for themselves. If you've
Mhm.
never had a mental illness and it's not in your family,
Yeah.
and it came on, and there
Mhm.
was, especially if there wasn't necessarily, like, you didn't go through a divorce or lose your
Yeah.
job or something like
Yeah.
that. I strongly encourage you to push your doctor to investigate other causes, or
Sure.
seek a provider who will do that for you. And those providers, I would say, typically tend to be more in the functional or integrative space.
Yeah. Yeah, absolutely. That's such a great point. And I'm a huge believer in this too. Like dig deeper, right? Like don't just take the first thing that you hear from your psychiatrist in terms of mental health or you know, I would say dig deeper. And I've myself have gone to integrative medicine practitioners and have found out like my hormones are like super wonky and I'm like, oh, that really explains like that period of time or like, or whatever. I'm also from the East Coast and have known a lot of folks who had symptoms of Lyme disease, but you don't have the knowledge in the most of the healthcare space where people would be like, oh, that sounds like Lyme disease. And then they send the, test off and it comes back positive and they've been living with fatigue, with pain, with depression. And all along it's been a tick bite, that they just
Mhm.
didn't know. And it's
And let
crazy.
me say, you said the East Coast there. I want to reiterate that we used to believe that that was one of the primary regions, but
Mhm.
it has spread throughout the entire United States. And
Believe that.
so if you're having symptoms that you think might be Lyme related and you live in Utah or Colorado,
Yeah.
don't let anyone dismiss that as it can't be Lyme because you're in Colorado or you grew up in Colorado,
Yeah.
because we have them now. And also, Lyme, if you didn't know, is transmitted also through fleas. So you
Hmm.
can get it through flea bite, and it is also sexually transmitted. So
Really?
so if
Huh.
you have a partner who had Lyme or has Lyme, you can obtain it from them. And there are
Interesting.
people who are carriers, who don't necessarily have the Lyme symptoms for the
Hmm.
Lyme disease, but they are carriers of the Lyme illness. And Lyme is not just one thing. It's a
Hmm.
multitude of different types of um, bacteria and
Yeah.
items that live in your blood. So things like Babesia, Borrelia, those are all Lyme. So Lyme is
Hmm.
kind of this general term for a multitude of different things.
Yeah, that's super interesting. And I actually did not know that about other ways that it can spread. And I didn't know that about fleas. Really good to know. And definitely encourage folks to seek integrative medicine. If you know something's wrong and no one is being able to get to the root cause of it, I would seek out integrated medicine for sure. I'm a huge component of that. So, before we go into more about like the root cause, you mentioned to me that you have your own survivorship journey of breast cancer and later significant mold exposure. Tell us a little bit about that journey and what shifted in you as a clinician and as a human.
Ah, Um, so about this time last year, my husband was switching jobs. And I think people might have heard this before, but medical clinicians sometimes we're bad about taking care of ourselves.
Yeah. Yeah.
So actually, I had not had a mammogram
Mhm.
ever.
Mhm.
And I was like, well, I need to go. I was doing all these things. I was like going to the dentist and getting my eyes checked and doing all those things that you needed to do before he switched jobs so I could use that up on my husband's insurance because
Sure.
my health insurance was through him. And I went to get my mammogram and they called me and said, we need you to come back for a
Mm.
diagnostic mammogram and an ultrasound because we saw something.
Mhm.
And I was like, okay. So let me tell you the caveat to this story is that my mom is one of three women, three sisters. She is in the middle. And my grandmother, their mom, my mom, and both of my aunts all have had fibroids in their breasts, which is just, you know, a lump of consolidated tissue that sometimes will show up on mammograms and look like it possibly could be breast cancer, but turns out not to be. I had all
Mhm.
had those and had been cleared, and nobody had ever had breast cancer, and nobody in my family that I knew of at the time had had breast cancer. So I'm like, okay, I'm gonna go
Yeah.
in, everything's gonna be fine. They do that part, and they are doing the ultrasound, and the radiologist comes in, and she's saying this doesn't look very good. It looks irregular on the ultrasound, and we need to schedule you for a biopsy. So
Mhm.
I'm like, okay. So they schedule me for the biopsy. I go through the biopsy, and because of my belief in my family history, I'm still kind of, I'm a
Mhm.
little concerned, but I'm like, not, we've been through this before.
Yeah.
Everything's going to come back fine. And I finally get the call that everything was not fine.
Mm.
I ended up being diagnosed with invasive ductal carcinoma with lobular features.
Mhm.
And actually, they told me that I was very fortunate because ductal carcinoma, like the word um, is it you have ducts in
Mhm.
your, just like you have ducts in your home, kind of you have these like tunnels
Right.
in your breast called ducts,
Right.
and basically the cancer is growing inside those. So
Mhm.
they said that often they get missed or don't get diagnosed till later because they look like the normal tissue growing. And
Mhm.
so they said that I was very fortunate that whoever was reading my reports did a really good job because and picked up on that super early. Um,
Yes.
so that was definitely a shocker, and especially from a when you're a clinician and you start hearing these things and you start going through the process, it's very interesting. I did a lot of videoing on my social media about things that I dealt with, and there's similar things that we're talking about and that we started talking about was my experience with conventional medicine.
Mhm.
Um, so I was fortunate to find a really good surgeon. They recommended a lumpectomy and not a
Mhm.
mastectomy,
Mm.
which basically the statistical evidence at the stage I was, there was no need. The long-term
Mm.
outcomes of reoccurrence was exactly the same whether you had a mastectomy or a lumpectomy. So I
Mm.
decided to have a lumpectomy, and I did have lymph node involvement. And when
Mhm.
you have lymph node involvement, they do recommend whether you have a mastectomy or you have a lumpectomy, some form of radiation or chemo.
Yeah.
In my situation, she also explained that some women do opt for mastectomies to
Mhm.
avoid doing radiation.
Ah.
But she felt so you can do that um, in the case of if you have no spreading into the lymph nodes.
Sure.
Um, but in my case, I had spread into the lymph nodes, so she basically said it didn't matter. Their recommendation was radiation,
Mhm.
regardless. Um, for me, it was interesting because I know a lot of things, but I don't know anything about, or at the time, about oncology. So
Yeah.
um, it was a little bit of a learning curve and it was very scary. And there were certain things that they recommended to me that I did not want to do or always believed
Yeah.
in
Yeah.
because of my background in functional medicine and the things that I knew on
Mm.
a different level. So
Mhm. Mhm.
um, I really did not want to do radiation. Radiation has been linked to heart conditions,
Sure.
bone deficits, and there are some evidence out there that in the long term, it doesn't actually specifically change your outcome, although it
Mhm.
is the
It's a
conventional
risk. Yeah.
medicine recommendation. So here you are, and I actually have a friend who is a nurse practitioner who was diagnosed with breast cancer at the same time, who also
Mm.
is into functional medicine, and we both talked a lot and struggled a lot with. We were both two women who had come up in conventional medicine,
Yeah.
but then eventually went into integrative alternative medicine, and so we believe in both. And you get stuck in this well, conventional medicine is telling me all this, but I
Yeah.
also have this whole other knowledge base that they don't believe in.
Yeah.
So you can't talk to them about it. And if you do, they usually tell you no.
Sure.
Um, and and you have to kind of depend on yourself to do the research and be comfortable with whatever decision you
Mhm.
make. And if you decide, I'm not going to do radiation, but then you have an occurrence later, how am I going to feel about that?
Yeah. Yeah.
That I'm, even though I made the decision based on
Mhm.
a lot of really good research and things I know, but since it wasn't the conventional, I chose not to do it. How am I going to feel about if something bad happens later? Am I going to believe is it going to stick in my mind that that was because I made that decision?
Sure.
It becomes really, uh, complicated, almost even more so for medical providers when we're trying to make the decisions about what's right for us, and
Yeah.
we seek
Yeah.
advice from different people as well.
Yeah.
um,
Yeah. Absolutely.
yeah,
Go
so I
ahead.
did radiation, but I also did high dose IV vitamin C while I did
Mm.
radiation.
Okay.
And I
Yeah.
see that integrative doctor. His name is Dr. James Roach. He
Uh-huh.
wrote a really great book called Vital
Yeah.
Strategies in Cancer, who also helps me guide because I need guidance as well.
Oh, absolutely. Yeah, we all do as clinicians, and I think um, you really hit the nail on the head when you said that like as a social worker and therapist, and you as a nurse practitioner, I think it's like we sometimes don't take our own advice, and we question others in the field because we know the background, we know the approaches that we take. So we're always like a little skeptical, but I think that you found the perfect approach for you. And so, are you in remission now?
I don't know if you would say I'm in remission. I don't know when they
Yeah,
tell you that or not.
I don't know.
To be honest with you, recently had a scare where I had inflammation and swelling in the area that I had the lymph nodes removed, and one
Yeah.
of my cancer markers called a CEA was elevated. So they full body scanned me again, and didn't find anything significant
Hmm.
for any of those causes.
Wow. Okay.
So the recommendation, and I did another ultrasound. So the recommendation is to do another ultrasound in 3 months. And I'm coming up on my year, so I'm getting ready to do a mammogram. I will do a mammogram and
Okay.
revisit with
All right.
um, my surgeon. My breast
Yeah.
cancer is estrogen and
Mhm.
progesterone positive. So interesting enough,
Hmm.
I do hormones. I'm a hormone specialist. I
Yeah.
prescribe them to women, and I
Yeah.
still believe in them. Just so everybody knows that out there.
Yeah. Yeah.
But I had to stop all my hormones and go through menopause.
Hmm.
That was not fun. In the middle of, so you find out that you have breast cancer, and they take all your hormones away from you. And
Yeah.
so you're dealing with the emotional part of breast cancer, but then you're also dealing with the crazy moods and emotions and the
Yeah.
night sweats,
Oh yeah.
and the hot flashes that all come with menopause, like all of a sudden. Uh,
Mhm.
so that is a big challenge. And
Yeah.
one of my big complaints was that I felt like conventional medicine was like, this is what you do.
Yeah.
And I believe that my answer, here's conventional medicine, here's, integrative or holistic medicine. I believe the answer, what I needed to do was like somewhere in the middle. And I didn't feel like they gave you room for that.
Yeah.
And it was
Yeah.
disappointing. And that is something that I want and I'm very interested in providing
Mhm.
that for people because everyone's journey is different and everyone has the right to decide what is the right treatment for them because they
Yeah.
are the ones ultimately that deal with the consequences, even positive or negative. And I think as a clinician, that's one of the things that I learned was how important that is not to take that away from the patient, that the
Yeah.
ability to decide what is correct for them, regardless of whether I think that's correct or not.
Mhm.
My job is
Mhm.
really just here to counsel the patient, tell
Sure.
them what I know, and give them options so that they can feel comfortable in the decisions that they're making.
Yeah. No, I can really appreciate that and your expertise, but also your lived experience. And so with your lived experience and combining your clinical practice, I want to talk a little bit about how you like define your approach. Can you walk us through, like, if someone is coming in new as a new patient, can you walk us through your intake? Like, what are you looking for? What dots are you connecting? Timelines, triggers? Like, what are you looking for?
Well, we're looking for everything, kind of, to
Yeah.
be honest with you. But
Yeah.
well, my process is I offer a 30-minute kind of intro consultation, and we charge $10 for that. It's 30 minutes, but the $10 goes towards a breast cancer charity called Living Beyond Breast Cancer.
Amazing.
That is not for us. We send that money to them,
Yeah.
and that's just kind of to help people so that we know that you're serious about wanting to see us.
Yeah.
Um, so we give you 30 minutes, and basically in that conversation is time for you to just see if we're going to be a good fit and you can move forward. And we kind of talk about what they're looking for, what they want to treat, and
Hmm.
whether or
Hmm.
not I'm the right person to do that or not. And 100% I will tell you, I don't see every patient. Um, I often, if I have a colleague that I think is a better fit for
Hmm.
somebody, I will send them that way
Sure.
because I want you to get the best care, and it's not always with me.
Yeah.
Um,
Yeah.
After that, what we have is a new patient program, which
Yeah.
includes two 90-minute visits, a medication history review, and a care plan development.
Yeah.
So the first
Cool.
appointment in that 90 minutes, before that we send you out all our new patient intake,
Hmm.
which is pretty extensive with a lot of questions about symptoms. And then I also ask people, which I find that to be very helpful, especially if
Mm.
it's something that's been going on a long time, is to think back to when you felt the best.
Yeah.
And all of y'all out there can do this, and I recommend you
Yeah.
do this because it could be six, when you were 6 years old. It could be way
Right.
back that far. Go all the way back then and write down everything you can remember about
Mm.
your medical and mental health history, like all sixth grade, I was getting in trouble, and my mom took me to the doctor and they put me on this medication. Or
Mm.
I started having behavior problems right after I had strep. Um,
Hmm.
and then in high school, I had a lot of sinus infections and I took a lot of antibiotics.
Mm.
And so I tell people, go all the way back till now. And sometimes that takes time, but honestly, I cannot tell you 90% of the people usually come back and say they had, like, tell me what happened. Like, they have
Yeah.
aha moments because
Yeah.
they never actually sat down and kind of thought about it that
Yeah.
way. And when you actually put the pieces down and you can look at them that way, it helps people put things together and
Sure.
sometimes find like what I call the root cause or the aha moment.
Yeah, for sure.
And a lot of times, patient after I ask a patient to do that, I don't have to figure out the root cause. They've basically figured it out and they've helped me.
Yeah.
They've helped me.
Yeah.
So anybody can do that, and I encourage anybody to do that if you're having, medical problems or mental health problems that
Hmm.
nobody has been able to help you figure out yet. So
Yeah.
I have them do that, and then so the first appointment they come. We talk about their symptoms, their history, how they're feeling, what they've been doing, and just kind of really try to dig into it. And I try to just give them the space to tell their story, which a lot of people have never had the opportunity to do so.
Yeah.
I know, and a lot of people will spend like 2 hours in the lobby and 15 minutes in their doctor's office. At my
Yes.
office, you'll spend 15 minutes in the lobby, and usually I say 90 minutes, but be honest with you, like I will go over
Yeah.
if the patient needs that space and we need that space for them.
Yeah.
Um, so kind of towards the end of that appointment, usually sometimes I start putting pieces together based on what they're telling me, and I'll have an aha
Mm.
moment and tell them, well, I think it's this. Sometimes it
Hmm.
can take a couple appointments for me to figure
Yeah.
things out. And I usually will suggest, like, these are the labs that I think we have to do. These are
Yeah.
the labs that I think we have to do, but maybe we could wait and do them later. And these are some labs that I think would be fantastic to have and would give us a lot of information. But we don't necessarily have to do them if that's, for instance, like genetic testing could be super
Yeah.
beneficial and help guide treatment, but I don't always have to have it, but it
Yeah.
can make a big difference. And that just
Sure.
sometimes has to do with people's financials. And
Yeah.
I really try to keep that. This type of medicine, unfortunately, is not cheap.
Yeah.
And I
Yeah.
do try to keep that in mind when we're talking about labs and things that we need to get for them.
Sure.
Um, and then I'll also usually make some recommendations, like try these three supplements,
Yeah.
or start walking your dog, get sunlight. Some of it's just, lifestyle changes. And
Sure.
then I'll send them on their way to kind of try those things, get their labs done.
Hmm.
And for me to have an opportunity to start requesting their medical records and get those in so that we can go over those and get the information. Then once we get the medical records, we get the labs back.
Yeah.
I'll have them come back for that second 90-minute visit. That's when
Okay.
we now kind of talk about, well, how are you doing? How did you do on the things that we recommended? Were you able to even follow through with them? Because I
Hmm.
always want to know also why people weren't able to follow through with things, so that not
Sure.
to make them feel bad about not doing something, but so
Yeah.
that I know what the obstacles are, because my job is also to help you remove obstacles so that you can
Hmm.
heal. Um,
Yeah.
and then I go over their labs, tell them what we
Hmm.
see, what I'm seeing, and kind of put all that together. And then I'll have them leave, and then I'll make their care plan and kind of present that to them through the patient portal. And that'll have all the supplements, recommendations, referrals to
Hmm.
I don't believe that one person can treat everybody. So I
Sure.
incorporate people like therapists,
Yeah.
uh,
Yeah.
psychiatric nurse practitioners,
Hmm.
acupuncturists, massage
Yeah.
therapists.
Sure.
For the mold patients, often there's like home testing and things like that.
Hmm.
So,
Hmm.
I try to bring the village in to help
Yeah.
the patient as
Yeah.
much as we can on all sides for them. At the end of that, they can kind of take their care plan and walk away if they want,
Hmm.
or they can come into my practice as a patient. We have some membership models
Yeah.
that we will then work with them through all that stuff.
Okay, okay, cool. Yeah, that's a very detailed process, but I think that by the time people are coming to you, right? Like if they aren't already on like the integrative medicine journey, by the time they come to you, like I think most people would be willing to do anything, at that point. Um, what kind of lab work and or assessments tend to be the most informative? Like right off the bat, when you're like, I actually don't really know what this could be. There's a ton of symptoms. Like, what kind of lab work are you doing for the beginning?
The funniest thing is, and they teach us this in school for doctors, nurses, and everybody, that the main thing is the history and physical.
Mm,
So it's not, the lab work is very helpful.
yeah.
But honestly, like I said before, the patient's story and history,
Mm,
that is the most helpful. And I think that's why patients sometimes don't get what they're looking for with other conventional medicine doctors. And it's not that they don't want to, so I'm not bashing them. The system is
sure.
not set up for them to spend that a lot of time with the client to
Yeah.
get all that information that could be helpful in figuring it out. But I would say that's probably the number one
Yeah, that makes
helpful
sense.
thing, to be honest with you. And then
Cool.
the other labs and things are, very dependent upon people's symptoms.
Right.
Most people, and I'll say 99% of people I see have the symptom of fatigue.
Mm-hmm.
So, looking
Mm-hmm.
at thyroids, hormones, and cortisol levels,
Yeah.
I just saw a client this yet or 2 days ago
Mm,
who had prostate cancer, had no
yeah.
testosterone because they had taken him off of that because of the prostate cancer. We
Right.
thought his fatigue was affecting his wife, him and his wife, because he had no
Mm,
motivation. He couldn't do
yeah.
anything. And we really thought the fatigue was his testosterone. But we did run what's called a 4-point cortisol. So your cortisol level goes up when you wake up and keeps going up till early afternoon, and then it starts declining slowly so that you can go to sleep at night. That's everyone's natural curve.
Yeah.
And
Interesting.
when we are stressed or have stressful events or have multiple stressors that build up over time, we can have high levels. And then
Yeah.
eventually what happens is there's no room at the end, and your little adrenal glands are like, hey, buddy, I have nothing to
Yeah.
give you. And they go,
Yeah.
and this
Yeah. Yeah.
guy's cortisol curve was flat.
Interesting.
I kind of thought it was going to be challenging, but I thought, oh, he's tired because of his testosterone. So just, example of things don't always happen in isolation, and there's never one bullet.
True. Yeah.
He
So
had
true.
no cortisol, and that when you have no
Mm.
cortisol, you have no energy.
Yeah. Yeah. No kidding. Yeah. I think, when, I think society hasn't fully adapted yet to like some of like the older medicine, like I just think of like my grandparents' age and older, like you're fatigued or you just need, I don't know, insert a spoonful of sugar. I don't know. So
Well, now they just think it's normal. They think
right, they do. Yeah.
fatigue is a normal part of aging, and I am here to tell
True.
most of you all that it is not. Usually, there actually is a reason why you're fatigued.
Yeah.
It is not always a normal part of aging.
Yeah. Yeah, no, that's really important too. And thank you for pointing that out. So my other question is how do nervous system regulation, sleep, which is like a whole other thing, and nutrition support any plan regardless of your diagnosis? And are you integrating those things in?
Yeah.
Yeah.
Well, good sleep and sleep hygiene, it's really a cornerstone, to be honest. and
Yeah.
and nervous system regulation, if we're not doing that,
Hmm.
it doesn't matter what's wrong with you. I'm
Yeah.
not going to be able to heal you, to be honest.
Yeah.
We really have to work on lifestyle changes and healthy habits.
Sure.
And it's very important for us to get full rested sleep. So even investigating sleep apnea. A lot of people have sleep apnea, don't even realize it. You do not have to be overweight or
Yeah.
snore to have sleep apnea.
Yeah.
Um,
Yeah.
and if you're not going to bed at a regular time, getting restful sleep, your body is not going to heal. Your brain is not going to work. You are going to be tired. Your brain isn't going to work well.
Yeah.
And it's going to be hard for you to follow through with healing at any level. So,
Mm-hmm.
very important. And then nervous system regulation. We live in a stressful world, right?
Yep.
And I think, people sometimes think, and like earlier I hit to like trauma with a capital T. Uh, you don't have to have like one bad event happen to you. It can
Yeah.
just be stress that builds up over time.
Mm-hmm.
And amazingly, like I said, that guy's line was flat,
Yeah.
and he was said to me, "Well, I don't feel stressed." And sometimes it's those people of you out there who think that you're
Mm-hmm.
not stressed, but you are. You're just internalizing it, and you're not
Yeah.
actually having healthy habits of dealing with those stress, which can be anything from taking a walk, doing
Yeah.
meditation,
Yeah.
having a therapist, if that works
Mm-hmm.
for you.
Mm-hmm.
Uh, Good sleep hygiene, petting your
Yeah.
dog helps with
All the things.
relaxation,
Yeah.
deep breathing, and there are 100 different ways to do it out there. So there's no perfect way. What I tell people is whatever works for you that you're going to do. Um, that is the that's the answer. The one that you
Sure.
think that you can follow through with, and that
Mm-hmm.
we can find that fits in your lifestyle and
Yeah.
your schedule. And sometimes you have to change things, like you know, working moms or moms who are trying to do everything right. Like they're getting up and feeding the kids in the morning, they're running them to school everywhere. Then they're coming home and they're mowing the lawn and they're scrubbing the house and they're running the errands and they're feeding their husband and they're paying the bills. I just read that if you paid a stay-at-home mom the actual going rate for everything that she did, her salary would be 250,000. Um,
Go moms. Go
yeah.
moms. I
So
am not a mom, but I props to moms.
So sometimes it's paying somebody to do those things for you, like
Yeah.
paying somebody to mow the lawn for you so that you can take that stressor
Yeah.
off of your plate. So
Yeah.
it's so that you have one less thing that you're worried about that is like
Mm-hmm.
pushing on your nervous system
Yeah.
and making things more stressful for you. And um, there's also something called the polyvagal theory,
Yes.
if you've heard of
Yes.
that. And there's an
Yeah.
exercise that you can do to reset that vagal nerve.
Mhm.
And people can get, so I'll basically what, your vagal and the theory is that, we all have fight or flight, right? Okay.
Yeah.
So if you're
Yep.
running from the lion, right? That's flight. And so what happens when the animal actually gets caught? And people miss this question. So what happens when the animal gets caught?
Yeah. I
Amber,
I don't know. I don't know. They go
what does
into
it
fight
do?
or freeze? I don't know.
What does it do when the lion catches it?
It freezes probably.
Freezes.
Yeah.
That is the polyvagal theory,
Yeah. Yeah.
is that it freezes.
Yeah.
So you get, so people think fight or flight, but the other place that people with that nervous system we get stuck at is the
Hmm.
freeze.
Yes,
And
so
you
true.
can actually, if you get good at this, you can see it. Patients will be, the mouth area will kind of be very non-expressive. Like the
Mm.
corners of their mouths and stuff. If you start looking at people frequently,
Uh-huh.
you'll start kind of seeing it. You're shaking your head,
Yeah.
I bet, because I know you're a social worker, and like if you think
I
back, you're like,
observe
oh yeah,
people and now I'm gonna
oh
really
yeah.
start observing people.
So um, this when people are stuck in that freeze, that is another reason for fatigue and depression. And
Yeah.
that by giving them a simple exercise to reset that vagal nerve to get them out of that freeze state,
Mm-hmm.
it can really help lift their mood and help them be able to do all the other things that they're trying to do, such as do therapy or meditation
Yeah.
or those kind of things.
Yeah.
Um, so
I love that. I think that people often miss how the mind and body is connected. I'm sure you've read Body Keeps the Score. I talked about that like on every other podcast because there is a connection. And the more stress you have, the cortisol levels are going to be wonky. And the great thing is, though, and this is kind of like maybe a controversial mindset, but also what my podcast is about, which is you have control most of the time of how you control your stress. And it's about how you react to stressful moments, right? Like in training, retraining your body, like with the polyvagal theory, to not go into those freeze modes because it really can change like the neuroplasticity of your brain, which I know you know, and like all the things. But it does impact your body so much, and there could be periods of time in your life where you're like have a backache for like 6 months and you're like, God, why will this not go away? Like nothing's working, chiropractor isn't working, like massages aren't working. You take that stressful thing out of your life and I swear it goes away. Stress is the cause of so many physical issues, and I can really appreciate that you recognize that.
yeah.
um, for
There's so
sure.
much new evidence coming out right now too about physical movement
Mm,
and doing physical movement to help everything else that you know, I know we're all out there struggling and trying to do the right things, and we're struggling trying to do the things that we want to do. And there's some new literature coming out that if you're sometimes if you're just doing the movement part,
yeah.
everything else will start falling into place. So
Yeah.
the movement being, stretching or taking a walk. It doesn't have to be, working out at the gym,
Mm,
but just some form of physical movement. And that if you
yeah.
start doing those, the other stuff will start falling into place.
Yeah, yeah, that's so true. Like you always hear people say, "Well, are you getting exercise daily?" And you're like, "Yeah, yeah, whatever." But like I do think that really genuinely has like it takes stress away. It's good for your body. Like why not? You always feel energized afterwards. Like it feels good. And we just have to take that first step of like going to do the thing.
Mhm.
And that is the hardest part. It is for me anyway.
Oh,
Um
100%.
yeah.
What
Yes. Oh, good.
I suffer from that too.
Yeah,
Um,
yeah.
Yeah, there's actually a research study that they did. One group, they took people with depression.
Yeah.
One group they gave antidepressants. One group they did exercise, and one group they did both.
Mm,
Uh, the group that did the best had the most relief was the antidepressants plus exercise. But
mm.
between the exercise and antidepressant group, which group do you think did better?
Oh, exercise, 100%.
The
Yeah.
the
Yeah.
exercise only group had better relief in their depressive symptoms than
Yeah.
the group
Yeah.
with just the
Uh-huh.
medication.
Well, it also gives you, like, from a psychology point of view, like, it gives you confidence. When you work out, you're like, I feel strong, I feel good, and that can boost mood and all the things too. So yeah, I know that actually makes a lot of sense. I would love to have you back on to talk about really specific things because I could talk about this stuff all day long. And I know the audience like are probably will have a lot of questions about really specific things. Like we barely touched the surface on, Lyme disease and mold and all the things. So I think it would be awesome to have you back on to talk about, all of the things that you have found throughout your practice because people are interested in it. People are starting to understand and see that modern medicine isn't always like correct, and it's not always the right approach, and sometimes it is, and a lot of times it is actually, but it's not always. And so getting to the root cause, I think, is so important. So we can definitely talk more about that. But before I let you go, where can people find you and Mountain Roots?
So you can find us on our website. Our website address is Mountain Roots, H as in Harry, H as in Harry.com.
Okay.
And then we are also on Facebook, Instagram, and we have a YouTube channel, Mountain Roots Holistic Health. And I have a
Awesome.
lot of educational videos as well, and interviews that I have done with other types of practitioners,
Yeah.
as well, on our YouTube channel. So it's always a good place where people can find information about hormones and mold,
Yeah.
and my personal journey, with the things that I dealt with breast
Yeah.
cancer, is also on video there too. If you're
Yeah.
interested in that kind of stuff as well.
Absolutely, yeah. And I'll drop all the links in the comments below. So whoever wants to go learn more about certain things, please go check it out. I'm sure we'll see Leah again. And thank you, Leah, for the work that you do and for sharing your story. I'm really glad that you were able to come on the podcast. I think that you're gonna impact a lot of folks who are at kind of like a loss, and hopefully encourage them to continue seeking and not give up. So thank you for everything that you do.
No, thank you for having me. I really appreciate it, and I
Of
definitely enjoyed
course.
it.